sexual disorder. So the clitoris is very similar to the penis, there is not so much difference, and is also easily accessible, is less mobile. The clitoris brings with itself a lot of information. So we should try to investigate this issue, and is still under investigation. So even when we consider this artery size hypothesis, which is the hypothesis by which we justify the association between erectile dysfunction and coronary artery disease. So it is based on the fact that cavernosa artery is smaller than coronary artery, and so it seems to be affected very precociously by the effect of atherosclerosis or major cardiovascular factor. If we look at the dorsal artery of the clitoris, is even smaller than the cavernosa artery of the male penile tissue. So this means that we should look at this type of artery because it seems to be smaller, and it seems also to bring a lot of information. And indeed, when we decided to measure by using Doppler ultrasound the parameters of clitoral artery blood flow, we were able to measure the vascular resistance in terms of PI, which is the pulsatility index. So the higher the pulsatility index, the higher the vascular resistance is, and the higher the cardiovascular, the atherosclerosis process. So this means that this we do not love to match this parameter to be at the higher value, but we would like to have a lower value. Indeed, what we found was that this clitoral PI increases a function of body mass index, increases a function of waist circumference, increases the function of triglyceride level, cholesterol level, and the cholesterol level. This was a very pilot study made in enrolling 71 patients. What we observed was that obese subjects has a higher level of clitoral PI as compared to non-obese one, and metabolic syndrome patients with metabolic syndrome has again a higher level as compared to patients without metabolic syndrome. And indeed, what we found was that the number of MET components could increase clitoral PI. So this means that there was an association. So clitoral PI increases a function of the severity of metabolic syndrome. So this means that they were deeply correlated to one each other. And when we repeat the same study but enrolling more women, so we arrive at which the 230 women consulted for male sexual dysfunction, the picture was exactly the same. So we were able to demonstrate again this association. And when we look at even an increased population, so 340, we are by now at this level, we're able to demonstrate again a direct association. So the clitoral PI increases the function of BMI, decreases the function of waist circumference in a very significant way. So what we decided was to evaluate the potential role of clitoral PI in predicting something. So we have the baseline value, and we could for sure demonstrate that there was an association. But to see if there is some clinical importance and relevance of this, we should also evaluate and assess if clitoral PI was able to predict some cardiovascular event in the future. So we decided to analyze a subgroup of women when we have the data at the baseline of clitoral PI, and we stratify and we measure these women by using the criteria of the Progetto Cuore, the EARTH project that we have in Italy, a program of epidemiology and prevention of scary heart diseases, and is able to, if it gives a score, it is able to predict the cardiovascular event. And then a subgroup of 117 were also evaluated and assessed after several years from the beginning in order to see the occurrence of cardiovascular events. So we could make a longitudinal retrospective study. What we found was that, again, the clitoral PI increased not only as a function of all the cardiometabolic risk factor, but also as a function of this score, the cardiovascular risk score at 10 years, that was calculated by the EARTH project program. So what we could say here that it was associated with a risk at 10 years of developing a cardiovascular event. And what we found was that in the longitudinal follow-up, we were able to find 6 cases with a major cardiovascular event, 1 case of ischemic heart disease and 5 cases of ischemic cerebral disease. And we were able to make this rock curve in order to find the cutoff with the accuracy of more than 83%. And the sensitivity of 100%, specificity of 70% to predict major cardiovascular events. So this cutoff was set to 1.448 of PI that was able to predict the onset of major cardiovascular events in women. And if you look at the table, you can see that the same prediction role was not potentially observed for waist circumference, HDL, cholesterol, triglyceride, glycemia, systolic blood pressure, and diastolic blood pressure. So this means that this parameter was even stronger than what we know the conventional cardiovascular risk factor. So the message here is that clitoral PI increases a function of a 10 years cardiovascular risk in premenopausal women. It's very important because the data will show you where in premenopausal women, so this means that there are very young women, and in very young women we could find the cardiovascular risk factor, and we could predict the cardiovascular risk factor in the future. So it's very important for prevention and for putting in place all what we can do to reduce the risk factor. And the cutoff value predicting major cardiovascular event was identified for the first time. So we can use clitoral PI as a marker for the cardiovascular event. So what we decided to study here was show you the data that we have already published, and then I will summarize something that we are doing right now, was that increasing physical activity can improve several cardiovascular risk factors, but also was able to reduce the score, the value of clitoral artery usability index. So this means that promoting a healthy lifestyle was able to reduce and to make an healthier artery, even in the clitoris. So if you look at this scenario, the take-home message here is that high prevalence of sexual dysfunction is true. They are present in several women with the cardiometabolic disease, so for example, type 1 and type 2 diabetes or obesity. Psychosocial factor, more than organic, play a crucial role in this condition. But if you want to measure and to have something in our hands to promote and to assess the cardiovascular risk factor, even in the female space and not only the male one, we should look at the proper, should use the appropriate instrument to measure the cardiovascular risk factor, and maybe to look at what we did in the past in the men is to use to focus in some way to the clitoral artery as well as in the corporal cavernosa artery in the male counterparts. So actually, might clitoral artery vascular impairment be an arbiter for cardiovascular disease? Maybe. We have some data showing that are very promising. Might sexual excitement, so for example, sexual arousal, reduced lubrication in some way be a sign that we could assess to predict? We have to look at in a very careful way. And maybe what I can tell you is that right now we are looking at the effect of reducing body weight by using, for example, specific diet or specific drug for reducing body weight in order to see an improvement of sexual function. So this is a work in progress, and I hope that in the near future, I will spend more words and save more data to show you the effect. So please consider that FSD is something that is very related to cardiovascular risk factor, and you have not trust to FS5, for example, to monitor and to have a clear assessment of this risk in women, even the young women in the premenopausal age. So you have to use the appropriate instrument to look at the vascular district as well as we made in the main space. Thank you very much. I hope in the future we could enlarge this type of research maybe together in order to disentangle this gender medicine issue. Thank you very much. Is there any question?